So Taryn, I'll have recorded your intro because I'll probably mess it up if I tried to do it live. But could you just start by telling the audience, where you're from, what you were into as a kid, just like your origin story, basically?
Sure. I was born in Detroit, Michigan. We lived there until I was about 8 years old. Then we moved to Murfreesboro, Tennessee, where we lived until I was 18. On my 18th birthday, my parents moved to Iowa, at which time I then went to undergrad at Indiana University. And from then on, I completed undergrad and then went to medical school in Des Moines, Iowa. And now, well, I should backtrack and say I met my husband when we were at Indiana University. I was a junior and he was a sophomore. We dated very long distance for several years when I went to medical school and got married right at the end of medical school. And he is from Indiana. So we made kind of a deal that if he followed me to Michigan for residency, we would come back to Indiana to settle down after we were completed with my medical training, as that's how we ended up down here in Indiana. So.
Love it. Your husband's a lovely guy. I've known him too. So can you talk about your current position and kind of, what you're responsible for? I think people hear these words, and at least I do, I think I get it. But then when I talk to folks like you, I'm like, well, I didn't realize that you were responsible for all that. Can you just kind of outline what it is that you do?
Sure. So I'm a full-time emergency physician. I work in a community hospital that we see about 25,000 patients a year, averaging about, on a normal day, 65 patients a day. Certainly that's been a little worse recently with the COVID surge. I also have additional administrative duties where I am the medical director and chief of emergency medicine for the emergency department. My roles for that, basically, I'm the supervisor of all the physicians that work in the department. I help to set the policies and procedures of how we treat patients in the emergency department, setting protocols for orders that can be initiated without a doctor seeing the patient initially. I am responsible for meeting certain metrics that we then have to report to administration. And that would be like the time it takes from a patient to be in the door to the time they're seen by a doctor, patient satisfaction scores, total length of stay in the emergency department. So I'm responsible for making sure that we as a group meet the metrics that we're supposed to be meeting based on our contract. I handle patient satisfaction as well and patient complaints. So if a patient has an issue with a physician and they weren't happy with their care or they felt the doctor was rude, I have to respond to those complaints. And basically just kind of being the overall day-to-day supervisor of the physicians there. Plus this is be my third year now that I've been the medical staff president of the hospital. So my duties there, that used to be called chief of staff, for those that may not be familiar with that term. So my duties there basically are, I am the chairperson of the medical executive committee, which is a committee of physicians that are kind of the decision makers for the hospital and how we take care of patients as a hospital, as well as we review the policies and procedures and those kind of things. I am also the person who runs the monthly medical staff meetings where we have a set agenda to just get information out to the entire medical staff. And then I'm also the chairperson of the hospital's peer review committee. So any cases that were felt to have a bad outcome or things didn't go the way that we expected them to, these cases go to peer review, and then I lead the discussion on those cases, and we try to resolve them and find learning opportunities in those cases. And then I also sit in on the monthly board meetings as well, the board of executives for the hospital. And I am not an official board member, but I do sit in on the meetings to represent the medical staff at the board.
What's it like to practice medicine as an expert and run a business? Because that's what it sounds like you're doing to me.
Yeah, it's crazy because I had no business training at all coming into this, and I don't like business. That's why I went into medicine, right? So it's been kind of trial by fire and learning a lot of things on the go. I've always taken the stand as an emergency physician that I don't really care about the cost of medicine to the patient as long as I'm doing what I need to do to make sure they are staying alive and, getting the appropriate care that they need. But going into these more administrative roles, you kind of realize that there is some importance to that, not just to the patient themselves to try to kind of limit their expenses, but also the hospital ends up writing off a lot of care when patients don't have insurance or they have bad insurance. We do write off a tremendous amount of care, and that certainly hits the pocketbook of the hospital itself. And then there is that kind of fine line of doing what's right for my doctors as well as doing what's right for the hospital, because physicians don't like to be told what to do. They're very strong personalities in many ways. You kind of have to be a doctor. And there are some things that administration wants us to do as physicians that don't always feel good, honestly. So I always try to explain to the physicians the why of why we're doing things. And when you get them on board with that and they really understand the reasoning why they're being asked to do something, they're much more likely to do that, And certainly I wouldn't ask them to do anything that I wouldn't do myself or that I feel uncomfortable with. So some of these things we are asked to do from an administrative standpoint, if I disagree with them, I'm not going to roll over and say that, yes, we'll do it no matter what. I always present the physician side and why maybe there's a different way to do it that works better for us, basically.
Yeah, absolutely. Did you always want to be a doctor? Why did you choose medicine? Were your parents in healthcare? What really led you that direction?
Yeah, I knew from a very young age that I wanted to be a doctor of some kind. I didn't always know what kind of doctor I wanted to be. A very early memory I have, I think I was maybe 4 years old. I have an older brother and an older sister. And we had one of those really old school stationary bikes that had actual spokes in the wheels. And, my brother was on one pedal, my sister was on the other pedal, and they were making the wheel go. And my sister's foot slipped into the spokes and took a big chunk out of her foot. So I immediately ran to grab like pillows and prop her foot up and went into kind of first aid mode while my brother freaked out and went and got her mother. And that was kind of the first glimpse that, this was kind of the life for me, but I was probably 4 years old, I think, when that happened. And I don't exactly know what triggered it or why. My grandfather was a general practitioner. He was a physician. We were not close. He did not encourage me to go into medicine. He did not really inspire me to go into medicine, but it was something I was always aware of because when we did get sick, my mom would just take us to his house, or, we'd be able to just walk into his office and those kind of things. So that was kind of an easy access point for us as far as healthcare goes. So again, I knew from a young age. And then when I got into medical school, I kind of came in with a notion I wanted to do emergency medicine. It's kind of cliche to say, but at the time I was in college, the show ER was very popular. And, I watched every episode, and it really did intrigue me and inspire me to do emergency medicine. And then as part of medical school, you go on clinical rotations during your 3rd and 4th year of school, where you do like a month in each major specialty and kind of get a good feel for what it means to be that kind of physician. And it helps you kind of make the decision of what kind of medicine you do want to pursue. And those rotations really solidified for me that emergency medicine was what I wanted to do, because I didn't like being in an office setting, seeing chronic conditions. I didn't like being in the operating room because the sterile nature of it made me feel really claustrophobic. So in emergency medicine, I kind of get the best of all worlds, where, I see a variety of cases from infants to elderly people. I get to do some procedures. You never know what's going to come through the door. So there's a lot of excitement involved in that. So that's my journey through medicine.
I'm glad people like you exist, Taryn. That doesn't sound appealing to me at all. We've been so lucky. Well, I have, at least, and I haven't had to do too many trips to the emergency department. But we had an event when we were on a little trip, like in June, and Annie, our daughter, had an anaphylactic reaction, and it was just incredible. Like from when you talk about patient experience and satisfaction, like from the time we rolled up to the time we left, it was just like so perfect. And the doctors and the nurses and the ER were like, you know, they made you feel really calm,
Mhm.
but not in a fake way. I was like, is she gonna be okay? And he's like, she should be okay. He wasn't like, yeah, she'll be fine. It was
Right.
like it was like a measured response for sure.
Mhm.
But for a person like me, I was like, I kind of appreciate that. So,
Sure. Sure.
um, so what's an average work week look like nowadays for an emergency physician?
So every group does scheduling a little differently. Um, my schedule, basically, I work a 6-day on, 6-day off template. And my first 2 shifts are day shifts, my second 2 shifts are evening shifts, and then I do 2 night shifts, and then I have 6 days off. Um, so we work in my group, my day and afternoon shifts are 8-hour shifts, and then our night shifts are 9 hours. And then we do have an overlapping shift from noon to 10 p.m. That's a 10-hour shift that I will occasionally get put onto that shift as well. So there are some, well, with me having these extra duties that I'm doing right now, as far as medical staff president and medical director, I do trim down by maybe 2 or 3 shifts a month, just because I'm going to meetings on my days off, or having to prepare for meetings. And I can't, as an ER doctor, just like block my schedule off for 2 hours to run to a meeting. You know, if I have a meeting that day, I have to actually take the shift off or get someone in to cover for me. So that makes it a little tricky as well. But there, in our emergency department, we are very feast or famine. It can go from like 2 patients in the department to 15 within a matter of hours. Sometimes within, like 30 minutes. It's crazy. So you do have to be able to change gears very quickly and change your tempo of working. And sometimes you're the only guy there at those hours if they come in before the second person comes in. So um, with COVID, obviously that's kind of up the game quite a bit, because now there's the uncertainty of what you're dealing with, because COVID has so many different symptoms it's presenting with that, you don't always know walking into a room if you're dealing with someone who's got COVID or not. So having to take those extra precautions with every single patient is time consuming sometimes, but also kind of limits the patient physician interaction somewhat too. Um, and then the biggest hurdle for us is charting, quite honestly, because, I'm seeing patients quickly. So I don't always have the time to sit down and complete a chart every time I see a patient. I try to get as much of it done as I can in real time, but there are times when I'm spending, up to 2 hours after a shift completing charts. And sometimes I'm even doing that the next day. And it's just a lot of, because of federal regulations and the EMR and all that kind of thing, there's a lot of extra documentation that has to be done that doesn't always really contribute to patient care, but has to be done. And certainly that does add the burden quite a bit. So,
I know just from Courtney working in healthcare and then various people in her family, they're always like, yeah, I'll be home after I finish charting. And it's like midnight. Like,
yeah. Yeah.
it's crazy. But obviously important, like you mentioned. I guess we've talked about the challenges a little bit. What is the most rewarding part for you, just as a physician in general? Like, what really, when you get home, you're like, all right, like that made it worth it, kind of thing.
Always when you have a good save, in my profession, that's always definitely a rewarding thing, because they really are so few and far between.
Mm.
Despite what you see on TV, when patients come in cardiac arrest, the chance of them surviving is less than 5%, if that. And if they
Yeah.
do survive, many times they're not the same person that they were. So when you have a good save, that's awesome. And honestly, we don't get a lot of thank yous in our career either. We tend to see people on the worst day of their life, where they're always, very emotional and under stress for having to come to the emergency room. Um,
Mhm.
and it's just expected that we are going to be there and take care of them. And we don't always get a lot of thank you for doing so. So when we do get those thank yous, it really does bolster you for the next day, quite honestly, and certainly makes you feel like you're doing a difference. I will say recently, the wins for me have been speaking to vaccine hesitant people and getting them to change their mind and consider getting vaccinated.
Mhm.
There are so many out there that are very, very against the vaccine, and I know I'm not going to change their mind no matter what I say, and they're not going to see the data as they should. They're going to flip the data around to fit their own, dialogue and whatever there. So when I
Yeah.
do have that one or two people, few and far between, that truly want to sit down and have a conversation about it and really open-mindedly learn the facts, I always take the time to do that no matter how busy I am, because those are the people we have the biggest chance of affecting. And um, again, those lately have been my little wins, is having those conversations.
Yeah. Well, that seems like a good way to really have impact at scale, because maybe you don't just save them, but you save the people that listen to them, you save the people who they're going to be around potentially.
Mhm.
Um, so yeah, that seems like a really important thing right now. Uh, Taryn wrote a great piece, sorry, Dr. Papandria wrote a great piece for Hancock Health's website, so I'll make sure to link that up everywhere this episode gets posted as well. Before we started recording, we did talk about some people I know who are in medical school or approaching medical school. So for those people, what advice do you have for them just in general? Like what kinds of things should they be thinking about or doing if their intent is to have a career like yours?
Medicine is a different world today than it was when I came up through medical school and wanting to be a doctor. It's much more challenging. There's much more, obviously, politicization to it, and so many more regulations on us now than we did not have before. So my biggest point of advice would be, this is not a job for someone who just wants to make money. This is not a job for someone who is just going into medicine because their parents expect them to do so. This must be something that you cannot consider doing anything else. It really should be a calling, and for so many anymore, it's not. And that's certainly being reflected in the care that's being delivered right now. For those that do want to pursue medicine and really do feel like it is the only thing in the world they want to do, basically spend time shadowing physicians in areas that you think you might want to practice, in types of medicine you think you might want to practice, so you really get a good feel of what it's about. When you go through rotations, those rotations that you're excited to get up and go to every morning are certainly the types of specialties or medicines that you should consider pursuing. Those that you have to drag yourself out of bed to go to are the ones you can automatically kind of check off your plate as far as, that's not what I want to do with my life. But you've got to put in the work. And, what back in the day, they cut down the amount of hours that medical students and residents were allowed to work. And I was already in my residency training when this kind of came to fruition. There was some good to it because they did find that, less errors were occurring when people had more sleep, obviously, and, those kind of things there. But I do think it's also has some detrimental effect too, because a lot of the newer physicians are not quite prepared for the stringency of patient care and the amount of hours that are necessary to actually get the job done, and being able to juggle multiple things at once, um, so you've really got to have the right constitution for medicine. And again, if you are on the fence about it whatsoever, then I would not recommend you even pursue it. So
Yeah, I've actually told people that. I'm like, watching doctors like you and being around other healthcare professionals, including my wife. I'm like, you really have to be all in on this, and for the right reasons, it seems like, because it's just way too hard to, like,
yeah.
if you only want to make money, like go into investment banking or something. I don't know, like, because
Yeah.
it just seems like emotionally, physically, mentally, one of the hardest things you could possibly do.
Yeah. Yeah.
All right, I'll lighten it up a little bit. The last two questions. I think, what is Taryn doing outside of work?
Oh, sleeping. No.
Yeah.
Well, because of my schedule, since I do the 6 on, 6 off, the 6 days that I'm working, I don't get a whole lot done at home, quite honestly. I mean, because my flipping my sleeping schedule days to nights, and you probably remember this from when we used to work together. Um, it's everything I can do to drag my butt out of bed sometimes, and certainly I'm not wanting to do housework and go to the grocery store when I'm preparing to go to work or after a long day at work. So my 6 days off, a lot of it is catching up on housework that I've neglected, getting to the grocery store, those kind of things there. But I also have 2 teenage boys. One just started college, the other's in high school. They were both into athletics since they were toddlers, essentially. So a lot of my time is spent going to sporting events and chauffeuring kids around, and hopefully that'll stop soon because my youngest is about to turn 16. Um, and just basically doing things with my family. I do like to bake. I'm a cake baker and like decorating cakes. I try not to do it that often because I'll eat them. Whenever there's a special occasion like a birthday or anniversary or whatever, I enjoy baking cakes for those kind of things there.
Yeah.
And I tend to watch TV quite a bit, honestly. Part for me is trying to decompress and kind of turn off the voices in my head and the things I should have done better at work and those kind of things there. So some people do that by exercising. Some people do that by, doing other hobbies and those kind of things. For me, it is just kind of like having my private quiet time and
Yeah.
having something to take my mind off of it. So that's kind of the way I cope.
Yeah. I suspect that's more important now in the last couple of years than it ever has been.
Yeah.
Um, and you could probably hardly turn on even fictional shows and not
Right.
see COVID. Like, so.
Yeah.
The last question I ask everyone is, what is the kindest thing someone has done for you at work? So, or just work related. So that for you, that could be everything from like medical school to where you're at in your current role.
Yeah, I can think of a couple things. A few years ago, I had to have surgery on my neck because I had a neck injury a few years ago that caused some nerve impingement, and I kind of kept it from everybody because I'm a private person. I didn't really want my coworkers to know that I was having issues with this. And suddenly it just came to a head very quickly where I could no longer work. I started losing strength in my arm and I was just in such severe pain I could not get out of it. So I basically ended up going to see our neurosurgeon and I was scheduled for surgery just a few days later. So when I had to take time off work and came back, a couple of the staff had knitted me scarves to keep my neck warm during my recovery and to hide my scar while it was still kind of gross. So that was very, very thoughtful. But kind of going back to the how we rarely get thanked in my profession. The one that was most meaningful to me actually came from a patient. I had taken care of a gentleman he's from out of state, but was on this bike ride across Indiana and collapsed during the bike race. So he was raced to our hospital by the pace car of the bike race, and we quickly realized he was actually in cardiac arrest. So we started resuscitating him, and it took probably 40 to 45 minutes to get his heart beating again. So of course I'm thinking to myself, this guy's not going to survive. His brain's going to be mush. I don't have a good feeling about this. And we ended up transferring him to one of the tertiary care centers to get his heart checked out and to, kind of give him the most optimal chance of survival. And that was kind of the last I'd heard of it. And then about, I want to say it's 6 months later, I can't remember how the time frame, he and his wife drove in from out of state to Indiana because they were visiting family, and they actually came to the emergency department to thank me in person. And he's able to go back he was a professor at a very well-known university, was able to go back to work full time, made a full recovery. maybe just a little bit of minor memory issues. So you're talking about the wins. That was a huge win. And then we kept in touch by email for quite a while, and they would celebrate his, what they called his second birthday, which was the day he survived his cardiac arrest. And they would call it Dr. Papandria Day. So
I love that. That is
yeah.
perfect. That is up there in best responses to this question.
Yeah.
Well, speaking of thank yous, like, thank you not just for your time today, but for everything you do. I think if it wasn't obvious to people how much you guys have to know and how much you have to work through, and not even just the practicing of medicine and being nimble on that side, but like for you running a business and leading other people, it's just massively impressive. So thanks
Thank
for all you do. I'm glad people like you exist.
you. I appreciate that very much. Thank you.
All right. We'll have a great weekend. I think I'll probably publish this like end of next week. So
Okay.
yeah, thanks again for contributing to the Waymarker community.
Thank you, and good luck to you all. Appreciate it.
Thank you. See ya.